Good afternoon, ladies and gentlemen, and welcome back to What Matters Gulf Coast. We have a very exciting Sunday for you today. Of course, this Sunday, the last Sunday in the month, is our health week, health Sunday. And we have our resident experts to talk to us about health issues and mental health. And we will start today with Miss Yolanda Long, who will give us an update. She's our RN, our registered nurse, and she will give us an update on health issues in Mobile County. Miss Yolanda. A pretty picture.
I hope everybody's doing well. We're turning the corner with COVID, and I'm so excited to bring with you the news that yes, the cases are going down, and we appreciate you all for doing everything you can to help us help health care workers combat this dreaded virus. But as of now, worldwide, we have had 474,114,550 cases of COVID. The deaths we've had are 6,098,771. In the U.S., we've had 79,708,062 deaths.
Mm. Mm.
In Alabama, we've had 1.29 million cases and 19,210 deaths.
Mm.
In Mobile County, we have had 113,000 cases and 1,617 deaths. But we are doing better with the vaccine. And that speaks to collectively to what we as a community, can do to combat disease and illnesses. But I want you all to remember to continue hand washing, using hand sanitizer, respiratory etiquette, which includes coughing and sneezing into your elbow, using masks, social distance, even though they're saying that in certain cases you don't have to social distance. But when you feel that you should, make sure by all means you do that. Make sure you use masks. Stay at home if you're feeling sick and seek medical attention if you have any signs and symptoms of COVID-19. The newest thing is Moderna is seeking emergency authorization of its vaccine for children 6 to 11 years of age. That's a game changer. And Moderna is also requesting authorization for a second booster. That is a game changer. We know that this disease is going to be around for a while, like the common flu. And just like flu and pneumonia, people do not realize how many people die from influenza every year and how many people die from pneumonia. With that said, it's going to be, that's what they're thinking, the healthcare world, is we're going to see it every year, spikes and declines.
Mm.
So we might as well get ready for it.
Mm-hmm.
The only other things I have for you this week are the April health observances. During the month of April, we'll observe World Health Week, World Immunization Week,
Mm-hmm.
National Minority Health. And what National Minority Health deals with, we know that we have to look at we're disproportionate to access and care. We have certain social determinants of health that specifically affect us. And this is an effort to build awareness about the disproportionate burden of premature death and illnesses in minority population and promote the benefits of physical health.
Mm-hmm.
We also have National Autism Awareness Month
Mm-hmm.
because we want to um, dismiss that stigma associated with autism. And we want to be more aware of and involved in autism and promoting its acceptance. Um, National Child Abuse Prevention Month. This is a big one. We have to change the ways in which we discipline our children, change that family dynamic of this is the way I was disciplined, and sit down and sometimes talk to your children. I know
Mm-hmm.
we all get angry, but we can round the corner on this one as well,
Yeah.
because we don't want to pass that down to our
Mm-hmm.
kids. National Parkinson Awareness Month or Cancer Awareness Month, and we have social, excuse me, Sexual Assault Awareness and Prevention Month.
Mm-hmm.
And we don't realize that sexual assault and partner abuse, a lot of that stems from home. They see the abusive behavior, and this plays out later on. And people don't see sexual assault as a domestic violence, but it happens within marriages, within relationship between partners. And so we need to look at rape, abuse, and incest, uh, and reinforce the need for more awareness and prevention around sexual assault. Another thing I would like to remind you of that's coming up this month is STI Awareness Month, the importance of sexually transmitted infections. People are afraid to get testing, and so we have to educate them and do prevention. Um, we have to get the tools and knowledge to prevent um, the transmission of STDs, and encourage people to be tested so they can be treated. And this will eliminate future STDs if they go ahead and get treated. And the stigma related to STDs and fear and discrimination,
Mm-hmm.
especially surrounding HIV and AIDS. Stress Awareness Month. People think of stress and they think about depression or um, attitude, behavior. It can affect your whole disposition
Mm-hmm.
um, mentally. But stress also has an effect on you, on your physical health, blood pressure, um, upset stomach. It can be problems with diarrhea, constipation. It can affect you in different ways. And stress can actually make you gain weight or lose weight. It depends on how you're dealing with it. I want to tell you all about testicular cancer awareness. Men, you need to go ahead and get these screenings done. Women as well, make sure we're doing all of our cancer screenings when we're supposed to, at the ages we're supposed to. And that's all I have you for your health tips this month. And um, come back and see us next month.
Okay, all right. We thank you. And we do know that our health expert is actually on the road, but she stopped to take some time to give us her report on her health update. And we do appreciate that. Thank you very much, Miss Long. And now we will turn the tables. I told you this is our health Sunday, and that is physical health as well as mental health. So we will now turn the mic over to our expert in the mental health field, and that would be Miss Alicia Richardson, who's going to talk with us about several of the mental health issues. Miss Richardson.
Yes, well, thank you so very much. Good afternoon, everyone. It is very nice to be here with you today. And I'm really excited that I have the opportunity to be alongside Miss Yolanda, because she was talking about several key things related to mental health. You know, the National Child Abuse Prevention Month, disciplinary practices, stress awareness, being mindful of how stress impacts our body, National Autism Awareness Month. All of these observances that we'll be doing are so very vital to our community. And so what I want to talk a little bit about today is bipolar disorder. But before I get into, bipolar disorder, I want to talk about mental health and mental illness. There's a health disparity in the African American community. And the rates of mental illness in African Americans are similar with those of the general population. However, because of the disparities that exist regarding mental health care services, African Americans often receive poor quality of care and lack access to culturally competent care. Only 1 in 3 African Americans who need mental health care receives mental health care. I cannot begin a conversation about bipolar disorder without first discussing mental health and mental illness. According to the Centers for Disease Control and Prevention, mental health includes our emotional, psychological, and social well being. Our mental health determines how we handle stress, how we relate to others, and how we make healthy choices. Although we use the terms mental health and mental illness interchangeably, it is important to know they are different terms. Mental health is a state of well being in which the individual realizes their own abilities and the individual can cope with the normal stresses of life and work productively and fruitfully. Mental illness is a disorder that can cause psychological and behavioral disturbances with varying severities. As a Black mental health clinician, it is important to me that I continue the mental health conversation and dispel the stigma of what mental health and mental illness looks like. It is the stigmatization of mental health and mental illness that is identified as one of the reasons African Americans do not seek the mental health treatment they need, often at a time in their lives when it can be most critical. I often compare mental illness to physical illness in the sense that when we feel something going on in our bodies that we can't explain and we become concerned, we tend to go to the medical community, particularly our medical staff, our doctors, nurses, practitioners. It is at that time that the medical staff can gain an understanding of our symptoms based on what we tell them to help them identify what is physically ailing us at the moment. An example would be a symptom of the flu or a cold. And once we can identify what it is, then we know how to treat it. The brain is like any other part of the body, and sometimes it too needs to be examined by a physician. Mental illness is among the most common health condition in the United States. There is no single cause for mental illness. When a person makes the decision to talk with someone in the behavioral health community, the behavioral health clinician listens to what the client is saying about their life. If it is appropriate and the person is diagnosed with the mental illness, it is because their identified symptoms, along with other measures, meets a diagnostic criteria. We must be careful to not assume because someone is behaving in a specific manner that they have a diagnosable mental illness. And we must, absolutely must, eliminate the term crazy from our definition, from our vocabulary. The word crazy has done more harm than good because anytime anyone does anything that does not align with our way of thinking, or they may handle a situation differently, it has been labeled as crazy. As a community that supports one another in any time of crisis, whether it be a medical crisis or a behavioral health crisis, we must identify those specific things that interfere with treatment seeking behavior. Labels are a big threat to treatment seeking behavior, and labels such as the word crazy can influence whether someone seeks behavioral health care. A big barrier might be that there is still a stigma or shame attached to needing mental health treatment, especially among the African American community.
Mhm.
According to one study, the attitudes of African Americans suggested that they are not very open to acknowledging psychological problems, are very concerned about the stigma associated with mental illness, and are somewhat open to seeking mental health service, but they prefer religious coping. Faith communities, despite their good points, can perpetuate or reinforce this attitude. Removing the stigma, or at least disregarding it, is necessary to get more African Americans into treatment that can improve their lives. We must acknowledge that mental illness is not a weakness, and we must recognize it takes strength to acknowledge a situation and try to fix it. According to the U.S. Health and Human Services Office of Minority Health, African Americans are less likely to have their mental health problems addressed than Americans as a whole, about 30 to 40 compared to 43%. While most studies find about the same or less, depending on the age, incidence of mental health problems among African Americans, they are less likely to seek help for it. Only one third of adult African Americans who need mental health care receive mental health care. And some of the reasons would include systemic racism, which is looked at as one psychotherapist calls it post traumatic slave syndrome. Because slaves weren't considered human, it was thought they couldn't experience mental illness. Because of post traumatic slave syndrome, descendants who have not directly experienced such discrimination may still feel the effects. Another reason is financial considerations. In 2018, one analysis found that 11.5% of Black adult Americans had no health insurance
Mhm.
despite the Affordable Care Act. That makes affording mental health services difficult. Another reason is faith based alternatives. In parts of the African American community, the church is more trusted than physicians, and maybe with good cause. Black Americans, African Americans who are members of a church or similar organizations do have a lower risk of suicide. Unfortunately, priests and ministers aren't trained to treat or recognize mental illnesses by themselves. Professional help may still be needed. According to Mental Health America, the experts say that African Americans sometimes talk about their depression in terms of physical aches and pains. If healthcare providers are not culturally competent about this form of expression, they might not realize this. It's more than just the blues. Depression is a serious mental illness and mood disorder characterized by extreme sadness and emptiness, a feeling that nothing matters or is worth doing. Depression can increase the severity and risk of both physical and mental illnesses. And there are different types of depressive disorders, such as major depressive disorder, which is a clinical, also known as clinical depression, that lasts for longer than 2 weeks, for at least 2 weeks. You have postpartum depression, depression lasting more than 2 weeks following the birth of a child. Seasonal affective disorder is depression which fluctuates with the daylight in the fall and the winter. Bipolar disorder, formerly known as manic depression. This is depression that alternates with periods of mania and exuberance. And so let's talk a little bit about Black Americans, African Americans, and bipolar disorder. An estimated 2.3 million Americans have bipolar disorder. A person with bipolar disorder can go from feeling very, very high, which is called mania, to feeling very, very low, which is a form of depression. And with proper treatment, people can control these mood swings and lead fulfilling lives. While the rate of bipolar disorder is the same among Black Americans, African Americans, as it is among other Americans, African Americans are less likely to receive a diagnosis and therefore treatment for this illness. Most African Americans with bipolar disorder are going undiagnosed and untreated, and several factors have contributed to this being undiagnosed and untreated, such as a mistrust of health professionals based in part on historically higher than average institutionalizations of African Americans with mental illness and on previous mistreatments like such tragic events as the Tuskegee syphilis study. There are cultural barriers between many doctors and their patients, reliance on family and religious community rather than mental health professionals during time of emotional distress, a tendency to talk about physical problems rather than discuss mental symptoms or to mask symptoms with substance abuse or other medical conditions, and socioeconomic factors which can limit access to medical and mental health care. About 25% of African Americans do not have health insurance. And there continues to be, and what we need to do is to develop an understanding and destigmatize mental illness. There are some signs of bipolar disorder. Bipolar disorder can often start in the teen years, but can emerge in later life. And it can be signs of mania, excessive energy, restlessness, and racing thoughts, and rapid talking, and needing just very little sleep, easily irritated. And although these can be symptoms, I encourage you not to just take these symptoms and say, aha, this is it. This is what I have. I encourage you to seek out a behavioral specialist, someone that you can sit down and talk about some of the symptoms that you are having, and let them determine by what you share with them if this is a diagnosis of mental illness. Again, signs of bipolar: increased sex drive, poor judgment, unrealistic belief in one's ability, aggressive behavior, substance abuse, paranoia. Some signs of depression: trouble sleeping or sleeping too much, poor appetite or eating too much, nervousness, worry, loss of interest, withdrawal from usual activities, and feelings of sadness that don't go away, irritability, restlessness, lack of energy. It's a wide list. And so, again, I encourage you, it's not just one thing, but it's a combination of things that you want to sit down with your behavioral health specialist, either your therapist or your psychiatrist or a psychologist, someone that specializes in behavioral health, to help you identify what you may be experiencing and ways that you can receive support. Um, no one knows what causes bipolar disorder, but the causes could include brain chemistry. There are chemical changes or imbalances in the brain during both mania and depression. Could be genetics. There's close relatives of people with bipolar disorder are 10 to 20 times more likely to get depression or bipolar disorder than other people. Stressful or disturbing events both can cause mood swings. But here's what you need to know: bipolar disorder can be treated. There is hope. And people with bipolar disorder can be helped by treatment. And one of my pet peeves is, people will often say, I am, or I have, this disease, this illness, and I say, let's recognize you as a person first. And so, you as a person who have a illness, a mental illness or a physical illness, can be helped by treatment. The treatment for bipolar disorder can be medications. It can be the doctor may recommend one or more medicine to find what works best for you. And I always suggest to clients is when you're on medication that you're communicating with your with your primary care physician or a psychiatrist, whomever has prescribed that medication to you. But just because a medication has been prescribed, there may be several medications to work for that particular diagnosis. But because of our body chemistries, different medications work differently. So communication between you and your healthcare provider, whether that be your mental health care provider or your physical health care provider, is extremely important. Another treatment is counseling. Often psychotherapy or other forms of counseling are used in combination with medication. There is also peer support. The advice and support of others who have bipolar disorder can aid in the recovery. You are not alone. Oftentimes when we feel what we feel and we go through what we go through, we feel like we're the only ones. Well, you're not alone. And sometimes peer support can support you as you move on your road to wellness. Another complementary care is another form of treatment. Some people benefit from exercise, stress reduction classes, and other activities to complement their treatment and help them manage their illness. So it's important that you look at your sleep hygiene to make sure you're getting adequate rest, to manage your stress, to hydrate your body, drink plenty of water, or enough for your body. And these are some of the ways that you can take care of yourself. And so, again, the focus today was to talk a little bit about what bipolar disorder is, to seek help if you feel as though you are experiencing some of those symptoms, but also to understand it is our responsibility as a community to destigmatize something that is impacting negatively our community, and that is the reluctance to address that there are mental illness issues. We can practice good mental health, but we must address the issues that are impacting our community. And so that's what I have to share with you today, and I just really appreciate having the opportunity to share. And you all take care.
Before you leave, Miss Richardson, can I get you to mention something about, or just speak a little bit about, we've always heard that bipolarism ranked very high in the Black male population. Is there any truth to that?
Well, Miss V, I'd have to do some research on that. I have not heard that. I
Okay.
know that one of the challenges, and the reason I say that is because African Americans don't often seek out mental health treatment.
Yes.
So it's very hard to diagnose someone that now it may be that they're experiencing symptoms, but if they're not sharing it with their primary care physicians or their psychiatrists or mental health providers, it can't be diagnosed. So looking at the numbers and looking at the fact that African Americans are not getting the treatment that they need with relation to mental health, that would be, really hard without me doing research to speak on.
Okay. Okay. Let me ask you one other thing. Can you give us kind of a glimpse of what one of the mechanisms you said with counseling could be the peer support? How exactly does that work?
Well, there are peer support groups, and sometimes you can access those by, maybe your primary care physician, or if you're in a relationship with a therapist that you sit with and talk with, they can make recommendations and share peer support groups out in the community. Or you can, nowadays, everything is easily accessible by social media.
Yeah.
And so it's just as easy to pull up bipolar disorder, or um, any other disorder on Facebook or Instagram. And there may be others out there who are sharing their stories.
Mhm.
And so, trauma, that's something often that is not really addressed. We have a tendency to overlook that. We call it everything but trauma. And when trauma shows up, it does affect our behavior. But there are peer support groups. And basically, what that simply means is there are other individuals who are out there who are living with maybe, let's, since we're talking about bipolar, there are other individuals out there who are living with bipolar disorder, and they may have been successful in their treatment, and they sit with others and encourage and support them through, their treatment, whether that be medication management. They'll talk about the importance of taking medication, the importance of meeting with your therapist, the importance of a healthy lifestyle. So a peer support group is really to support you in managing whatever it is that you need to manage.
Okay. Okay, great. Thank you for clearing that up for me. We do appreciate Miss Richardson, Miss Alicia Richardson, and today she spoke with us about bipolarism, but mental health in general. We do appreciate all of the time and effort both of our experts lend to us once a month on Health Sunday, which usually falls the last Sunday in the month. We do appreciate you joining us today, our audience, and we would like to invite you back next Sunday at the same time, same channel. We will be here, and we will see you next week on What Matters Gulf Coast. Thank you.